Yeah. Well, the Directing Council meeting is something that we always look forward to. It's something in which the ministers of health within the region gives strategic direction to what happens in PAHO. We look anxiously in terms of the discussion that will ensue with regards to the new strategic plan for the Pan American Health Organization for the period 2014-2019. As far as Dominica is concerned, we applaud the fact that the new strategic plan of PAHO took into consideration regional and global events. It also took into consideration what happens beyond the 2015 developmental agenda. We're very excited to note that as well. It seems to take into consideration challenges of small island developing states, in states like Dominica and the rest of CARICOM countries. Clearly, there are some challenges with regards to implementation of the new strategic plan, given the fact that the resources are dwindling within the region, and therefore we clearly would like to see the debate ensue in terms of advice that will be given to within the Directing Council to implement in certain programmatic areas within this new strategic plan of PAHO. So those are the discussion that we certainly like to see the Directing Council as it starts tomorrow. We also looking forward to the discussion, very interesting discussion that is going to ensue with regards to the international health regulations. Clearly, and Dominica probably will use the opportunity to thank the Pan American Organization for the sort of support that it has been providing to the region, or to member states, I should say, for implementing or meeting the obligations under the international health regulations. Clearly, Dominica would recommend or look forward for the further commitment and support from PAHO in terms of strengthening member countries meeting the obligation on the IHR, and certainly would like to see how PAHO would facilitate such discussion like South-South cooperation in assisting member states in meeting the obligation under the international health regulations. So those are some of the critical things we would love to see ensue in the discussion within the Directing Council. Well, for me, universal health coverage is a method, it's a methodology, it's an approach in which can be used to address the inequities in health. It's an approach which can be used to ensure that the majority of citizens within a country have access to affordable health care. It is an approach which avoids citizens from meeting certain catastrophic financial events just because they are trying to access health care. And therefore, the whole concept of universal health coverage is something that is very important. It is a means, as I indicated earlier, to reduce the sort of inequities that exist in the health system within all different countries and member states. And therefore, it's something that is very interesting, that Dominica is very interested in. We look forward to, obviously, the new discussion. Clearly, there have been changes in the definition of universal health coverage that has been ensuing from since 2005 to now. But I think the fundamental principle guiding universal health coverage is as how countries could actually address inequities in health and to ensure that more citizens in the countries, whether you're rich and poor, have access to quality healthcare services. In terms of Dominica in particular, one of the fundamental principles that's guiding the provision of services in Dominica is that no one who is unable to pay for health should be denied access to healthcare services. So that is what is driving the healthcare services in Dominica. And therefore, a number of policy decisions have been taken by government to ensure that that happens. Within our primary healthcare services, there is no fee at the point of service. In fact, no citizen actually pays for or direct payment for healthcare services, that is primary healthcare services, to access these services. There are other policy decisions that are taking place to ensure, for instance, that certain diagnostic services are placed within our primary healthcare services. Our main challenges a couple of years ago, 10, 15 years ago, were basically as a result of communicable diseases. Now our challenges, as is the case with most of the CARICOM states and member states, are definitely related to communicable diseases, the non-communicable diseases. And therefore, one of the things that Dominica is doing is to ensure that as we look at improving access to services, that we improve the sort of diagnostic services that we provide within our primary healthcare services network within the island. Even at the tertiary level institution, there are policy decisions in terms of ensuring that persons who are below the age of 18 years do not pay for any services, even at the secondary care services, and persons above the age of 60 years actually don't pay for healthcare services. So there are a number of policy decisions taken by the government rooted in a fundamental policy that no one should be denied the care for service because of the inability to pay, and to ensure that persons don't get catastrophic financial consequences as a result of of health condition which they may have. And that is something that I think, given the thrust and the push by the Pan American Organization in advocating for universal health coverage, clearly each country has to define what they actually mean by universal health coverage. As indicated earlier, PAHO is embarking in developing a new strategic plan which guides the way PAHO will deliver services to countries for the next, 2014, 2019. I think in this new dispensation, what has to happen is that PAHO has to engage nationals, or persons at a national level, to see how well some of those programmatic areas can be implemented. So there has to be much more discussion at country level, and certainly even in developing the strategic plan, there was this consultative approach used. But in terms of implementation of the strategic plan and addressing the program areas, there has to be more engagement at country level in assisting the delivery of some of its programmatic work, and that is something that we like to see done from time to time. And clearly, as I indicated, to foster cooperation between countries and among countries. So I think these are some of the things that we certainly like to see PAHO addresses. Engage nationals at a national level into the implementation of some of the strategic program areas, and fostering cooperation among countries, a source of cooperation into the delivery of those strategic programmatic areas.